done last week to make sure that you really fully understand how to take the data from the studies to appraise it for the appraisal tables that you're going to need for your evidence-based practice project paper. So I gave you a recent study that was done on professional attitudes of nurses and how it impacted nurse-to-nurse collaboration. When you open up and you're looking at an articles and you want to make sure and confirm that it's a study, how you know it's a study is it will have usually an abstract. It will have a methods section. It will have a data collection section, and it'll have an analysis section, and it'll have a results section. So if you open up what you think is a study and you're looking it over and it doesn't have those areas, more than likely it was a project that they're publishing, talking about a project or a change that they had made and the impact that they had. It's not a true study. And so when you're filling out an appraisal for it, you're going to find it very difficult to find the data that you need because it's not a formal study. So make sure when you're looking at the articles that it has those very key components. And some of them will say this study throughout. Now the abstract has quite a bit of information, but this is just a brief synopsis of the entire study. So if you're trying to fill out the templates, just using the data from the abstract, you're going to be short a lot of important information. So make sure that you're actually reading the studies themselves to make sure that they are appropriate and you're getting all the pertinent details. So now I'm going to go over to the key. The first section is the author. It acts as the in-text citation. So it would be the last names of the authors and then the year in parentheses. You don't need to include first names. You don't need to include initials. Nothing like that. Just make it very straightforward, like a in-text citation. For the design method of the study, in this section, you do not need to include these in yours. I just wanted to give you kind of a visual on what needs to be included here. The design method of the study is the what, why, and how of the study. It is what kind of study it was, why it was done, and how it was done. So for the design for this particular study, it was a descriptive cross-sectional study. The purpose was to determine how nurses' professional attitudes, what kind of effect it had on nurse-to-nurse collaboration. And the method is the how. So this is very important. A lot of students will include these two things and forget about this. So how did they conduct this study? Well, first they had to get consent from the nurses, and this was based on volunteer participation. It was not blinded. It was not randomized. If the nurses wanted to participate, they signed the consent. They got the questionnaires. So they were hand-given the questionnaires to fill out. Most of them filled it out in 15, 20 minutes and returned. The results then of these questionnaires, besides being analyzed for data, it was also then compared to findings from past studies similar studies that was found in the literature. So that's where the cross-sectional section comes in. This would not be a cross-sectional study if they didn't have other studies to compare it to. A lot of cross-sectional studies are set up where they do the first part of their study now, and then maybe in a year with those same participants do it again, or in 5 years with those same participants do it again. But in this case, they didn't compare it to the same participants down the road. They looked at other past studies, similar studies, to see if their findings were consistent and comparable. For the level of evidence, you want to look at the hierarchy of evidence pyramid. There's one in the week 3 required readings, and that's what this one is. Or you can go to your textbook, and on page 481, it's there also. But as you're looking at what kind of study, we know it's a cross-sectional. When you find a cross-sectional study, that is the level. So this is a level 4 study. That's all you need to include there. It's just the number. Some students try to get fancy and put in their I guess their rationale for making it 4. It's based on the hierarchy pyramid, so just 4 is fine. Then for the sample setting section, this is now where we get into the who and where of the study. So the sample always is a number, whether this could be a meta-analysis or a systematic review, and it would be the number of studies that were included. If it's an actual quantitative or qualitative, it's the number of participants. In this case, 1,200 nurses were qualified to participate.
I need
Only
a
409 of
article
them returned completed questionnaires, and so were included in the study. So I could also, if I wanted to put here, incomplete.
One of the jurors in Abby's trial just got sick.
Put that space there, okay. Incomplete
how you want to do it.
questionnaires.
What do you mean?
302 first. Isabel
Where?
already asking for it.
Isn't that why you came here?
Yeah, but I'm like how? What
So of the
yeah,
nurses
you need me
included,
to like log into the
12.2,
article.
and when you look in the
Oh,
you see a lot of
I mean, I didn't know you could
That
do
is really
that.
pertinent to the sample, so that's why I included it here. Broken down
I
by
have to
which
find that
units they
exact
worked
article
on
through here.
and
Yeah.
how long they worked
You
on
logged
those
in?
units, because that
No,
could
but I will
impact
log in in a second
their
to search that exact
attitudes
article through
if they're constantly being moved around from unit to unit. So that's interesting to know. And only 7.3% worked for over 10 years on that same unit. So that could have an impact. The setting, it clearly identified the hospital in Turkey that this was done. Sometimes it won't give you the location, but it might tell you that it was done in 3 rural hospitals with over so many beds, and that's fine, that can go there. For the independent variables, you need to clearly identify the IV and the DV to get full credit on these. If you look at the purpose, that's why this is important, it pretty much tells you
Your
what they are
computer stresses me out so much.
researching or what they are investigating
With all those-
is the
This is
IV.
ridiculous.
So in
Yeah,
this case,
that
it's
is
a professional
stressing me out too,
attitude.
but I have to do it because of
And then
research.
what the DV is, that's the outcome, is they're looking
You
at these
don't even
attitudes, seeing
organize
how
them
they
like in
affect
a way that makes sense.
the
Like,
nurse-to-nurse
this is my
collaboration.
emails on this
So
side.
the
I
IV
kind of did.
is the
I
professional
did,
attitudes.
just not this one.
But they
Bear
even
with me.
go further, and this is why looking further into the study, you get this information. They were looking specifically at their attitudes towards problem solving, communication, shared process, coordination, and professionalism, and how that correlated with their attitude towards nurse-to-nurse collaboration.
People,
Okay?
that's not that thing.
So you do need to identify very clearly what the IV and DV of your studies are. Measurement of data. This is how the data was collected. So in some situations, it could be, in this situation, it was through questionnaires and surveys. In some studies, it could be interviews. In some studies, it could be they collected it using, sometimes if it's a systematic review or a meta-analysis,
Okay,
they
go to
use
journals.
a guideline to help them extract the information from
Let me
the studies.
copy
And they'll
this.
clearly
I copied
display
these way too much.
name what that checklist or what that guideline was. Sometimes it's just searching through, the researchers search through the EMR, they used ICD codes or through the charts, but they'll tell you how and who extracted that data. In this case, they used 3 different questionnaires. And so I described what kind of questionnaire it was and what it collected. So I didn't just say this questionnaire, this questionnaire, this questionnaire, but also which each one, what kind of data did it collect and how. So that was the data collection, and this, that's not what I want to put. I don't want to put this.
Because it
Not
says,
this.
please sign
And in
in.
this
Can't you?
article, it
Well, I
was
signed
very
in.
clearly
I
talk
don't
about
have it.
the data collection tools
See it.
and
No, I'm just
that
like,
the data
why?
was collected between
It's
that
not
should be included
available.
on that chart. So this should have been
I
here,
placed the request, but that wasn't working.
data collected between March and May of 2019. I believe that's what that article said, right? 2019? Oh, okay. Yes, okay. Some of this I had put into the method section, so it doesn't need to be repeated. So that's how the data was collected. Now they got the data,
The
how they
journals
got
have
it,
to go
analyze it,
back.
and they give all that information in this section. So you want to make sure that you're including, if they tell you, the version of the SPSS, because you want to make sure it's the most up to date for when this study was done. It talks about the tests that were used and what they were used to test for. So as you're going down and looking in the analysis section, they talk about the different tests that were used. So you want to include that for that section, okay? For findings, you really want to find the findings that
See that?
helped them answer the purpose question. So because so the demographics found, because they had a demographics questionnaire, they had the attitudes questionnaire, and then they had the collaboration questionnaire. So you want to give some of the answers for each of those. For the
This
demographics,
thing
I
is
just
really
included
dark because it's doing
levels of each.
something on that one.
You can include
It, like,
whatever's going to be
grays
helpful for your
everything,
project.
that's
Then the first questionnaire, what the mean score was and what that indicated, and because this is a cross-sectional, how did it compare? What did they find that it compared? Then looking at the other questionnaire, what were the findings? And that one was the one that broke down each of those independent variables. So you want to share each of those and how it compared to previous studies. Again, it's a sectional, cross-sectional. They found that there was a weak relationship. That was all said and done. And for this particular study, they found that although they had high the OPAI scores, they had lower NCS scores, and that they found that those that did score highest in these 3 were the ones that were working for university hospitals, held bachelor's degree or higher. So they're showing an interrelationship between the 2. For the strengths of the study, you want to, not all studies will say this is the strength. Some of them will, but not many.
Okay,
You
honey.
have to draw it out. So what you're looking at is not the findings, but how the study itself was done.
I want you to know that I found it, okay? I copied and pasted, and you were like, okay, I don't have it. I'm like, no, let's do the DOI.
Study to the ethics.
Who has the login though?
There you go.
Magic
The ethical
credentials.
rights of the participants was protected, so that's helped to eliminate some bias. Then you look at the method, and they used questionnaires. Well, what's important about the questionnaires? These were instruments that they had found in the literature in the evidence base. So they had they had a demonstration from past studies that was well tested, but they also then tested each of the questionnaires for reliability within their own study. And for the OPI, they found
You should have saved your credentials.
0.906. For the NNCS, because there was the different sub-items, they all tested.
So I could keep on researching.
If you go to your textbook on page 376, the very last line on that page talks about this particular analytic test, and it says when the Convex alpha value is 0.70 or higher, the instrument is considered to be reliable. If it's reliable, then you can expect the findings to be reliable. So that's a strength. For the limitations, a lot of studies will have a limitation section before they go into their discussion. This one did not. However, as you read through the discussion, they share for each of the components some of what they thought could be possible limitations for their participants compared to those of the previous studies. So those are the things that you can include here for limitations. For example, for the collaboration, where their score was moderate. They said that they felt it could be because the nurses in Turkey worked too many hours and cared for far too many patients and performed tasks that are out of their scope of practice. So that's why they scored lower in that area. That's what one of the limitations they thought. So that's the information you can include here. Like I said, some studies will have a whole section of limitations, which makes this very easy. But in this one, you really had to kind of search for it. But the appraisal or the clinical significance, you probably won't find that spelled out in the article. You can look at their discussion or their conclusion, but this is the part where you're going to take what value from this study you have when it comes to your project or to your personal study. You're not going to say, my study is, you're going to keep these very objective. Do not make it, once you start using personal pronouns like you, me, our, mine, it now becomes focused on your opinion and your perspective and not the evidence or the data from the study. So you're going to make this very generalized and talk about, so for me being in academia, it told me that the importance of nursing collaboration really needs to be focused on more when it comes to training. Because those that came
What are you saying?
either in bachelor's or beyond, they
What
scored
pen?
higher in collaboration than those that were in other undergraduate programs. There was a lot of feelings that the nurse recruiters in Turkey didn't really involve staff nurses in the interdisciplinary
Congratulations.
to actually help them to grow that skill. So that could be something that could be done on the unit with the nurse leaders, trying to involve new nurses especially into collaborative settings. So that's what I pulled out of this. You may have pulled something different, but the point is this is something that you're going to be applying to your project. And again, you're not going to say in my project this applies. It's just making it very generalizable. So like if you, your population is ED patients, whatever your application you make here could be applied to all ED patients, not just yours. That's how I mean by generalized. Not to all patients, but to all ED patients, because that is your population is ED patients. If you have any questions about any of this information, reach out to your instructor, give your questions, or you can reach out to me directly.
Can I live my life?
Whichever works for you. If you want to put your full reference in APA format at the bottom of your tables, when you put it into your paper, now this was not going into your paper, this was just in an exercise, but when you put it into your paper, you won't include the references because papers only have one reference page, period. So all references have to be on the reference page. But your instructor can give you feedback on that
Oh, God.
if you want to put the full reference in your
You spit it out of my neck!
study
What'd you say?
that you did this on. And
She tell me every day.
as you are submitting that,
What did you say?
Thank you for
make sure that you're also including the PDF version of your study, because you will lose points if you don't. So that hopefully helped you clarify what needs to be included on your appraisals. Happy hunting and researching. Have a good semester.
Want some of my dick?
Sure. Why is it hard?
It's partially hard.
I need to shower.
Why? So you can suck it?
You're nasty.
So you can suck it?
Cause you nasty.